I'm Dr. Samantha Senti from the Bagel Office of Thompson Healthcare and Sports Medicine. Today we have patient Savannah here who's been experiencing dysmenorrhea. Dysmenorrhea is just another way to say menstrual cramping. Typically around her cycle she experiences lower abdominal pain and low back pain. Today we're going to be working on something that I call the period protocol, and we're going to also get her adjusted as well. The purpose of the period protocol is to release the ligaments in the bottom lower pelvic area of the female pelvis. This helps the uterus from spasming, and we're also going to work on her low back. This also helps realign and balance the pelvis as well as her low back. We're going to loosen up her uterus, the round ligament, and the psoas, as well as the Quadratus Lumborum. We're going to check for trigger points in that area. After her adjustment, she would be able to be coming back to the office 1 or 2 times a week to have this done, especially during her cycle. We're going to get started with Savannah now. First, we're going to begin with Savannah laying on her back for us. During the cycle, there sometimes becomes swelling in the abdominal area due to normal hormonal changes. So what we're going to do with Savannah first is we're going to have her bend both of her knees, and we're going to find and locate the uterus in her abdomen. Typically during the period, when women have their period, the uterus will spasm, and during this process, the spasms are muscle spasms, which will cause pain in that area. So first I'm going to make a fist, and I'm just going to roll over the top of Savannah's uterus and hold my hand here. At this time, I'm looking to feel for muscle spasms underneath my hand, which indicate that the uterus is spasming, obviously because she's menstruating. So I'm going to just hold my hand here for a couple seconds until I feel the uterus stop spasming. Okay, so once it stops spasming, I'm going to then contact the round ligament on both sides of her pelvis and apply downward pressure. This helps to loosen up that ligament in her pelvic area. Once this ligament gets loosened, it reduces the pressure in that area and also reduces the pain. So I'm just going to hold it here for a couple seconds. And while I feel for that ligament to release, typically when a woman is ovulating or on her period, one side is a little bit tighter than the other, and she'll feel that discomfort during this on that side. And then I'm going to slowly release my hands off of that area. Then I'm just going to raise the table up for her, and we're going to release the psoas muscle. So we'll start with this side and have one leg down. And using ART, we're going to release it, but on this left side first. This muscle typically also gets tight, and it connects to the lumbar spine. So this pulls on the low back and can cause low back pain during a woman's period as well. So we're going to release both sides. Once we release this muscle, we're going to work on the posterior spinal muscles. We're going to start with the Quadratus Lumborum. I'll have Savannah flip over onto her stomach once we lower the table. Okay, you can flip over. I'm going to be feeling around in this muscle specifically for trigger points, and I will be holding pressure onto the trigger points for a few seconds just until they relax. Typically there's more than usual during a woman's period just because of everything that's happening. Okay. Once I finish releasing the ligaments, I'm going to adjust Savannah. So I'm going to have her lay on her side facing me first. Right now I'm adjusting her lumbar spine, which will help balance her pelvis and her low back. So I'm going to bring her over here. All right, and we'll go to the other side. Good. Okay. So we'll have Savannah sit up. We will also incorporate rapid release into the end of this procedure to her low back, just to help with muscle spasm in the area. And that's it for her. In conclusion, the purpose of this adjustment is to loosen the ligaments in the pelvis. By doing this, it will help relax the uterus during the woman's period. This causes pain and tenderness when the ligaments are not relaxed and not stretched. So today we realigned her spine, we balanced her pelvis by working through the psoas muscle, the quadratus lumborum, the round ligament, and then the uterus as well. If you or anyone you know is experiencing abdominal pain during the menstrual cycle, feel free to come join us over at Thompson Healthcare and Sports Medicine in the Bayville office.